Did you know that getting a simple sore throat can make you get kidney disease? Well, welcome to our YouTube channel, Health Tips and Tricks. I am your physician, Dr. Andrew, to take you through today. And we are going to be talking about the causes of kidney disease and how it can be prevented. If you're new to our channel, kindly subscribe so that you continue receiving our videos to help you live a better life and improve your health and well-being. Many people have a relative, one or two, a friend, a loved one who have suffered from kidney disease. And it leaves them wondering, what causes kidney disease? So and so was healthy yesterday. And tomorrow we hear that, he's now in hospital with kidney disease. What could have happened? So hopefully this will help you to learn some of the things that can cause kidney disease and hopefully prevent them so that you can live a more healthy life. Diseases, for example, diabetes. Diabetes, we all know it's a disease where your body cannot control your sugar very well and it leads to you having high blood sugars. So diabetes is one of the common causes of kidney disease. And if you have a colleague, a friend, or even yourself or a loved one with diabetes, it is important that they get proper treatment to avoid kidney disease. High blood pressure, the same thing. If someone has high blood pressure, it needs to be controlled. It needs to be within the normal range. And we said for a young person, we want you to be 120. So if you are within the normal range, then you will prevent kidney disease. Now, there are some other conditions which sometimes you may not even know of. For example, you get a simple sore throat. You get a skin rash. And many times we take these to be light. But sometimes these can heal and lead to a certain condition where the disease spreads to the kidneys, something we call glomerulonephritis, one of the ways. And when this happens, you can easily progress to kidney disease. So if you have a colleague or a loved one, or even yourself, and you get a simple sore throat, please get it treated and get the proper treatment, because this can easily progress into kidney disease and leads you to have kidney disease. Then we have the drugs we take, different drugs we take. Some people use herbal medicine, almost all the drugs we give from the pharmacies to manage pain, to manage maybe stomach irritation. All these drugs have an effect on the kidneys. They can affect the kidneys and make the kidneys sick, and this can lead you to get something we call interstitial nephritis that can progress to kidney disease. So it is important that all the medicines we take should be prescribed by our doctor, and we should use the proper prescription, not getting over-the-counter medications. We talked about different kidney diseases which we are sometimes born with, which are inherited within the family. For example, polycystic kidney disease. You have seen, I don't know, some of you have probably heard some people who are born with kidneys and their kidneys have cysts, their kidneys are swollen, or other inherited diseases that can also lead you to get defects in the kidneys. So all these can be a cause of kidney disease, and that's why it is important that once a while we get screened. You can do blood tests, you can do an ultrasound scan of your kidneys, so that we make sure that your kidneys have normal structure, have normal function, they are getting enough blood supply, and also some of the values which we check in blood to make sure they are normal. So that's very important. And then 2, we have obstruction of urine flow. So once your kidneys are supposed to let urine out. So if urine is obstructed, then it will flow back to the kidneys and it will make them sick. Some of the things that can cause obstruction, we have things like prostate cancer among men, we have things like cervical cancer among women, and all these can easily lead you to get kidney disease if urine flow is obstructed and it flows back to the kidneys. And this can progress to kidney disease. Then, of course, we have the vesicoureteral obstruction, where we see either the bladder or the ureters have abnormalities that don't allow the proper flow of urine, and this will also lead to backflow of urine, which will also affect the kidneys, just like what we have talked about previously in something we call reflux nephropathy. And then we have recurrent infections. If you are getting recurrent infections, some of you know them as UTIs, recurrent urinary tract infections, UTIs. And one of the most significant ones, what we call pyelonephritis. So this can also lead you to get kidney disease. So it is important that if you get recurrent UTIs, urinary tract infections, you go to your doctor and all the time they tell you have UTI, it is important to visit a physician and have your body and your health assessed so that you can know why do you get these frequent infections, so that the root cause is managed and you don't progress to kidney disease. Then of course we talked about other causes, for example among pregnant women, a disease we call preeclampsia, that is basically a disease you get in pregnancy and your blood pressure goes up, and some mothers can even get fits and seizures. So this is also a disease that can lead you to get kidney disease, can cause kidney disease. And if you have this, it is important to have checkups during your antenatal care, have your blood pressure measured, have your urine tested, and maybe even have your kidney tests done, because this is a disease which you can get and it can lead to kidney disease. And then how do we prevent some of these things? How can we solve them? How can we protect ourselves from getting kidney disease? Of course, addressing all the above and basically following the instructions of your doctor, avoiding over-the-counter medications, aspirins, ibuprofen, and even other drugs which are used to relieve stomach upset. Some people have a common term, these ulcers. You are treating ulcers with drugs and you're using self-medication. These are all not good strategies. You need to see your doctor and get the right treatment, because all these medications which you're using to self-medicate can lead you to get kidney disease. So avoiding all these, we are protecting ourselves. Avoiding herbal medication, herbal concoctions whose composition is unknown. These have to be avoided to protect your kidneys, because some of these contain harmful substances that can lead to kidney damage and then progress to kidney disease. And then maintaining a healthy weight. We saw that obesity is one of the things that can predispose you to kidney disease. So maintaining a healthy weight, this can be achieved through diet, having a healthy diet, plant products. This can also be achieved through regular exercise and activity, and maintaining a normal weight. Those who have overweight, to cut down on the weight, and this will protect your kidneys from kidney disease. Then avoiding exposure to toxins like smoke, alcohol. These can predispose you to getting kidney disease. So by avoiding them, you're protecting your kidneys. And also manage all your medical conditions with help from your doctor or physician. If you have hypertension, if you have diabetes, if you get small infections like sore throat, get them treated promptly so that you avoid progression to kidney disease. Thank you very much for your attention. I hope this was helpful and we have been able to learn about the causes of kidney disease and how we can prevent it to live healthy lives. I remain your physician, Dr. Andrew. Thank you for your attention.